It's interesting though, because there are a number of different approaches and some myths, I think, about self-harm. One of the big ones that we often see is a real conceptualization of self-harm as being what some may call communicative or manipulative, or in any way sort of saying it is kind of not real at the core, but instead an attempt to sort of tell someone how difficult it is. And often those types of conceptualizations don't gain the most compassionate response from others because, of course, you know, people don't like feeling manipulated, they don't like feeling like they're being told or made to do stuff. My name's Jake Camp. I'm a clinical psychologist and DBT therapist, or dialectical behaviour therapy therapist. And I particularly work with young people at high risk of self-harm, using DBT as my main therapeutic model. We try and stick to a much more sort of factual description around thinking, yes, there are functions of self-harm which are about communication in the same way that there is with all behaviours, because, you know, the way that we communicate obviously is a lot to do with words, but actually we think is more to do with the sort of behavioural aspects of body language, actually what we're doing and so forth. And therefore, we like to stick for that particular myth with the idea that even if it is trying to communicate something, it's still an attempt, a solution to trying to get a need met. And if that need met is trying to get someone to hear them or validate them or see their pain, our job is to try and help them find ways to communicate that, and for the other person to hear it and listen genuinely, in order to know that they don't need these other solutions to get that particular need met. The other thing that often comes up as well is what's sometimes called harm minimization, or particular techniques to sort of make the damage that self-harm can cause to the body as minimal as possible. So in some cases, this is where people recommend sort of lighter forms or lower severity forms of self-harm, such as what sometimes is referred to as superficial cutting. And other times this might be proxies of self-harm. So this might be an elastic band on the wrist, or holding a very cold object that's going to affect the skin and make a certain amount of pain. In DBT, or dialectical behaviour therapy, we very much stay away from this, and even in the National Institute of Health and Care Excellence guidelines, they also sort of really air caution with this type of approach. The reasons for this is sort of twofold. Firstly, you would have seen my hesitance a little bit as I was describing the severity of self-harm. And that's because in DBT, we very much stay away from that at all. And we very much stick with it. It is all life-threatening, no matter how light it is, because we know that, like, the biggest predictor, one of the biggest found effects in psychological research is the biggest predictor of future behaviour is past behaviour. And that particularly is behaviour that's in a similar context. So i.e., if you're using an elastic band on your wrist to sort of simulate the feeling of self-harm, that's likely to predict future self-harm, rather than it sort of predicting people finding alternative strategies. Within that, what's important as well is that what we don't ever want to do is invalidate people and sort of, you know, make them feel like they're not, like, doing enough to harm themselves. They're not showing their pain enough. You know, so we quite clearly want to state that we find it's all life-threatening. I do not differentiate by severity, and given that my job is often, you know, to keep my client alive at a sort of primary goal, what I really want to hit home is, like, we need to get this off the table. You know, we need to find alternative solutions. And this then links into that other reason why. Because if you're, say, I don't know, trying to learn a new skill, but like a really complex one, let's say, I don't know, like riding a motorbike. I can't say I have massive interest in riding a motorbike, but let's say learning to ride a motorbike. But, you know, you can drive a car. So you've got some, like, transferable skills. But let's say I'm trying to learn to ride a motorbike, but every time I go out, I just get in my car anyway. So I never actually got on a motorbike. And then suddenly one day when my car breaks down, I'm like, oh crap, I need my motorbike. You know, get on that to drive away, and at least to say it doesn't work very well because I've not practiced or learned. So this is the issue. If you're using harm minimization strategies or self-harm generally, you're going to limit the amount of time that you can use to practice the more adaptive skills, which require a ton of practice, because it takes a long time to make something easy to use when we're finding things really difficult, and for it to become quite automatic. So these are sort of two of the main things that we tend to hear about and tend to stay away from as well.